Genito-pelvic pain is the pain or the inability for the woman to tolerate sexual intercourse, and how it affects women psychologically is quite varied. It can affect their sense of self, their sense of self-worth and their self-esteem. They often feel like they're not able to live up to their role as a woman by not being able to engage sexually with their partner. They can have fear about maintaining the relationship. They can have fear about being able to conceive and have children. They forward project on how they will be able to do things that are really at the heart of being a woman. So it can drastically affect a woman's sense of self. The causes of genito-pelvic pain disorder can be physical, emotional, psychological. Some of the physical issues are general tensions, so just like a woman can have a tight back, a tight neck, she can also have a tight pelvic floor. She can also overtrain her pelvic floor in things like gymnastics, Pilates, dancing, ballet particularly. She can have hypermobile hips and activate more strongly through her pelvic floor to try and stabilise her pelvis. Emotional things around fear. So if the woman has heard a lot of stories about sex being bad, painful, bleeding, etc., then the fear can lead to the pelvic floor muscles being tight. There can be cultural beliefs, so in some cultures there's a real lack of awareness around the woman's anatomy and what the pelvis is and what the pelvis does and what sex means and how that's meant to feel and what's in it for a woman as well. So that can also lead to the pelvic floor being tight in anticipation of sex. Physiotherapy can also help the mind and the brain, which is a really major component to this condition. So a lot of it's based on reducing fear. So fear is a really big component to this particular condition because of the experience with pain and the anticipation of pain. As soon as the woman has fear, the pelvic floor muscles will tense and protect the pelvis. And we treat that by really establishing mindfulness around the pelvis in terms of how the woman holds the pelvis. We talk about focusing on the things that feel good rather than anticipating pain. And other strategies that help really the mind relax and subsequently relax the muscles as well. My name's Angela James. I'm a pelvic physiotherapist from Sydney Pelvic Clinic in Bondi Junction, and I specialise in pelvic pain.